KTN News, Nairobi.
Now, Dr. Alfred Karegu is the CEO of the National Cancer Institute, the ones that have released the statistics that we're talking about in that story. And he joins me in the studio now. Dr. Ari, thank you very much for joining us. Good evening.
Good evening. Thank you for having me.
You have released some grim statistics, basically showing that there are very many new cases of cancer being reported across the country, very many deaths. Of all the new cases that you've reported, when talk about 42,000 new cases in a year and 27,000 deaths, it's over 70% of people who are diagnosed with cancer ending up dying. Why is that figure so high?
Well, generally, and why the world over, cancer is on the rise. And more specifically, in our country, the case is not different. We are seeing quite an upsurge of cases. There are many factors that may explain this. One is that we have enhanced our capacity to diagnose cancer. So many cancers that would have been missed previously are now being diagnosed. Second thing is that generally our life expectancy has improved. So we know that advancing age is a major risk factor for cancer. But more importantly, I think what concerns us most is most of these cancers are actually lifestyle. They are associated with various lifestyle factors. You know, consumption of tobacco, consumption of alcohol, change in our dietary habits. So all these are potential drivers to what we are seeing. But I would say the greatest concern for us is the fact that about the top 5 cancers actually account for 45–46% of the total burden.
Yeah.
And yet these are highly preventable, highly curable cancers that should not be causing as much mortality as they are. We see a lot of breast cancer cases, a lot of cervical cancer, a lot of prostate cancer, a lot of cancer of the esophagus, a lot of cancer of colon and the cancer of the colon, which are essentially detectable early. So what we need now to be thinking about is how do we scale up awareness? How do we scale up services to across the country so that more people come out early for screening? Because our data shows that about 70% of our cases will be diagnosed in advanced stages. So I think that is probably the crux of the matter.
And so they end up in death.
Yes, they end up in death. Because
so this issue then of early screening and the awareness that needs to be created. We have had conversations previously with even those who are in this space, who are helping patients. And one of the things that keeps coming out is the early screening and coupled with Kenya's health-seeking behavior. So why can't you move screening services from hospitals and take them to the community?
Well, there are some that are happening in the community. It all depends on the type of cancer. There are certain cancers that are amenable to screening at the community level. Case in point, cervical cancer, because the tests involved are fairly simple. So the testing technology can be deployed all the way to the community level. But for some of these cancers, case in point, breast cancer, for instance, at the population level, we recommend that women who are aged 40 years and above get at least an annual mammogram. You see, a mammogram is a major equipment that can only be domiciled in a hospital setting. So I think it calls for a mix. So there are those that definitely can be done at the community level, and there are those that probably because of their nature then would have to be limited to the hospital setting. But I think the biggest need for us, or the biggest what we really need to drive is awareness coupled with behavior change, because I think that's a missing gap. Awareness is growing, but we are yet to see some good translation in terms of people taking action, behavior change.
Has there been any campaign that you've proposed as the National Cancer Institute, going to governments, going to the county governments, that then would be on complete behavior change awareness? A proper behavior change campaign saying smoking, drinking, the food that we eat, lack of exercise is a leading cause of?
Yes, we have actually sustained, we have ongoing awareness campaigns. I will let you know that at the Institute, we actually have developed some very simplified, very easy to read materials. And we have translated this into about 10 languages. So we have been working very closely with our county health teams to spread this kind of awareness. We are using the community health strategy approach because we have our community health volunteers. So when we empower them with some of these simplified messages, they're able to translate the same to the local, to the local communities. We have also even tried to scale this up even beyond the health sector. So we are engaging with the other non-state actors. For instance, we are working very closely with the Huduma Kenya Secretariat so that we can use the network of Huduma centers to really, create awareness about, cancer across the country. So we, I don't think we can talk about a one-off because behavior change is, it requires sustained, yes. And that's why even, engagements, collaborations with the media so that every so often we go out there with, in the vernacular FM stations particularly so that this message, resonates throughout
the director is telling me that we need to just conclude the conversation, but I've got to ask you this question.
Yes.
Is there sufficient budgetary allocation at national level and at county level specific to cancer?
The simple answer is no. We need to do more.
How much more?
I will tell you, when you look at our Kenya cancer policy, it's very clear that from the financing data in 2019, only about 1% of our healthcare budget went to cancer control. For us to make impactful change, we need at least 10% of our healthcare budget going to cancer control. So I think that is where the conversation needs to be going. Resource allocation at the national level, at the county level needs to, because the disease burden, when you look at the contribution of cancer to the disease burden, it's about 10%. So we need to match the resources to the burden. Yes.
Dr. Alfred Karegu, thank you very much for speaking to us. And as you prepare for the conference that we've just talked about, the summit that's going to be taking place in February, we hope to see a lot more conversation around cancer and a lot more attention from government as well.
Thank you for having me, and we really look forward to partnering with everybody to have a very successful summit, which runs from the 2nd to the 4th of February next year, as we also commemorate the World Cancer Day. Thank you.
Asante sana. So let's take a break right here on Newsline. We'll be back shortly with more stories.